I'm Dr. Lisa Wilson from City Psychology Group, and today I'm going to be talking to you about addiction. Addiction most usually refers to a condition which involves engaging in a pleasurable activity to excess. We can have the potential to find any behaviour addictive, so to some extent we will all engage in a behaviour to excess. So that might be on a weekend, it might be about shopping, it might be about being on the internet, it might be spending a lot of time perhaps on your iPhone. These are all things that we might describe as addictive, but don't necessarily interfere with your everyday life activities. And this is the point. When something starts to interfere with your everyday life activities, and when it's something that becomes particularly compulsive, so we perhaps feel unable not to do it, then we might talk about that behaviour being an addictive behaviour, one which has the potential to cause us some quite significant problems. So for example, it might interfere with our work, and it might interfere with our family lives, or some of those responsibilities that we would ordinarily be doing on an everyday basis. While there is debate amongst academics and in the media and the legal system about what constitutes a valid addictive behaviour, within psychology we usually think about any behaviour which we engage in that is rewarding as having the potential for addiction. So for example, the internet, gaming, sex, pornography, drugs, alcohol, food can all hold the potential for an addictive behaviour. Life is hard, and as a consequence we develop coping strategies in order to help us with it. And what those coping strategies normally help us to do is to get some more pleasure in life. So the behaviour that we engage in will be about getting some reward, getting more of a particular feeling that we want, but it also is about helping us to get rid of or cover up feelings that we perhaps don't want quite so much. So we'll engage in one of these particular behaviours in order to help us to cope with life, essentially. So when we find a coping strategy which helps us to feel good, or helps us to avoid or escape from feeling less good, then we want more of it. We want to do it again. And when we keep doing it again, over and over again, no matter what the consequence is, it then becomes something that may be described as compulsive or an addiction. Suddenly, the thing that we were choosing to do, we lose control over, and it becomes involuntary. It's now become a habit. When the coping strategy involves the use of a substance, we're introducing a chemical. And consequently, this can have an even greater effect upon our reward centres in our brain. And so consequently, it can make it more likely for us to do it again. The repetition will, of course, be dependent upon a number of different factors, and also how badly we experience the removal of the substance. So for example, if you overuse alcohol, you might experience a particularly bad hangover the next day, or the detoxing experience might determine how quickly or how much you're likely to use alcohol again. In summary, when a number of the following features are present, then we might describe somebody as suffering from an addiction. A strong desire to use a particular substance or engage in a particular behaviour. Physical withdrawal when we're thinking about chemical substances. Inability to stop the behaviour or to reduce the behaviour. Interfering with life activities and responsibilities. Neglecting particular interests that we perhaps once had. And signs of tolerance. So perhaps the person needing to do the behaviour a bit more or use a bit more of the substance because the reward is less each time. In order to address addiction and to bring about change, we need to bring this particular behaviour that's become a habit back into our conscious control. Bringing it back into our conscious control, we also need to then address new coping strategies. We need to build new habits. We need to build in new reward strategies in order to assist us with life that is hard. Changing a habit is difficult, and with the right combination of psychological, social and biological support, it really is possible to do this. One of the things that we also need to do is begin to address the thoughts and emotions that underlie some of these coping strategies that actually help us to build new ones that are going to work for us in the future. We need to learn particular strategies for helping us to sit with difficult feelings and to deal with them differently. There are a number of different therapeutic approaches that can be helpful, and at CPG we can help you with those, including acceptance and commitment therapy and other third wave cognitive behavioural therapies. What's important for us to remember is that we all have the potential to suffer from the condition of addiction. We all engage in behaviours to try to make us feel better, and as a consequence, nobody is immune. It is a symptom of being human. The extent to which that behaviour affects other people or interferes with our lives, or perhaps even has legal implications, will usually determine the level of problem that it causes in our lives. Nonetheless, this is a condition that requires lots of support, lots of social support, and is not simply a matter of increasing our willpower. I'm Dr. Lisa Wilson. I hope you've enjoyed this video. If you haven't already, please check out our other videos. And if you have any suggestions or questions for future videos, please contact us at the email address on screen.